family, welcome back to my channel. Thank you so much for coming back. My name is Victoria, and on this channel we'll talk about health, lifestyle, challenges, school, and a little bit of everything. Feel free to join my family by clicking on the red subscribe button and turn on your notification bell to know whenever I post any new video. On today's video, we'll be talking about female genital mutilation. Yes, you can still call it female genital cutting or circumcision. What is female genital mutilation? Female genital mutilation is the practice of total or partial removal of the external female genitalia. That is what female genital mutilation is all about. The practice of total or partial removal of the external female genitalia. We have 4 types of female genital mutilation. Number 1 is called clitoridiectomy. What is clitoridiectomy? Clitoridiectomy is the practice of total or partial removal of the clitoral gland. That is the external or visible part of the clitoris. And it's actually the sensitive part of the female genitals. That's the part that is sensitive in female genital. Type 2 is called incision, which is total or partial removal of the clitoral gland and the labia minora. The labia minora is the inner fold of the vulva, and sometimes they also join the labia majora, which is the outer fold of the vulva. Type 3 is called infibulation. Now, what is infibulation? Infibulation is the practice of narrowing the vaginal opening through the creation of a covering seal. This seal is formed by cutting and repositioning the inner or outer labia with or without removal of the clitoris. This is just like stitching and narrowing the vagina to avoid sexual intercourse. That is what it's all about. Type 4 is unclassified, meaning that it involves all harmful practices that is being done to female genital area for non-medical purposes. Any practice that is being done in that particular area for non-medical purpose is unclassified. That's type 4 of female genital mutilation. And this unclassified includes scraping, incising, pricking, and piercing the genital area. All these practices is unclassified. What are the health benefits of female genital mutilation? Well, I'm sorry to disappoint you. There is no health benefits to this practice. All that is involved in this practice is harm. Starting from the day 1 to the last day is harm. There is no benefit. If there is any benefit, maybe you let me know, but I know there is no benefit. Female genital mutilation only causes harm to the women and girls, and the practice can lead to short or long time health risk and complication. Misconception of people around us concerning female genital mutilation. I used to hear people say something like this: if you don't circumcise female child, she'll be jumping from one man to another. That's not true. It's a lie. That is not true. Those people that you think that will not even jump from one place to another, that you scrape everything, may even do more than those ones that you think will, turn the whole world around with sexual intercourse. That's just the truth. Some others will say, please don't tell me that I must do that to my female child. I don't want when her on this, touches that area, it will just be, scratching her to go and have sex. That's just lie. And when you ask them, have you seen somebody that such a thing happened to? They will say, no, that's what people used to say. And they believe, they depend on hearsay, not that this have actually happened or they have witnessed such experience. That talk is very, very bad and it's not true. It is not true. I can categorically tell you that saying of when you're on this touches the clitoris, if the female child is not circumcised, she will now run out to go and meet a man because all her body is sweating her. It's not good. It's not true, because all her body will just be like, wanting a man. It's not true. All that is associated with this practice is risk. There is no health benefit, but rather risk. Now let's look at the health risk involved in this particular practice. And in this health risk, we have short health risk and long health risk, meaning that it starts when this particular practice is being done. Then long time is what you may face in future or what you will see or experience in future. What are the short time health risks involved in this? Number one is severe pain due to the cutting of the nerves end and genital tissues. Number two is hemorrhage, which is excessive bleeding. This can occur when the clitoral artery is cut off. If the clitoral artery is cut off, it can result to excessive bleeding, which can actually lead to the death of the girl child or the woman. Number three is shock due to pain, hemorrhage, and infection. So infection can also be introduced into the vulva through this means. Number four, infection. This can occur when unsterilized instrument is used. Number five, HIV. This is also caused when cutting off the female genital area with unsterilized instruments. Sometimes you will see a child of 1 year testing HIV positive, and when you test the parents, they will be HIV negative. You'll be asking yourself, where is this particular thing coming from? Some of them comes from such practice because you don't know how neat those places is. You just take your child there because you want to do one practice to stop her from jumping from one man to another, or from that clitoris scratching her, which is very, very untrue and bad. Number six is urinary retention and pain during urination. All these things may occur. You may see a lady, whenever that lady wants to pass urine, you will see that person passing through pain. Number seven, impaired wound healing. This practice can also lead to abnormal scarring, which is not good down there. You see a lady, when that lady undress, you see one big scar on that particular area because of the wound healing process. And whenever your female child sees that scar, honestly, she won't be happy for what you cause, all in the name of trying to limit her, like you said, from jumping from one man to another, which is very, very wrong. Number eight is death. Death may occur due to infection, tetanus, and hemorrhage. You may just lose your girl child, all in the name of one practice that is very, very wrong and unhealthy to female child. Now let's look at the long-time health risk of this particular practice. What the female child may experience in future as the child develop and grow to adults. Number one, vaginal problems such as dysmenorrhea, which is painful menstruation. Number two, irregular menses and difficult in passing menstruation. All these things can come from such practice. You may see a woman for the 4 days or 5 days that she is going to have her menstruation, she will be in pain that in fact will even be crying for her. Such practice can cause such pain. All this occurs due to obstruction of the vaginal opening, especially in type 3 of female genital mutilation. Number two, obstetric complication, which is during childbirth. Difficult labor, obstetric laceration or tear, increased risk of cesarean section, postpartum hemorrhage, which is bleeding after birth, episiotomy due to the narrowing of the vulva. All these things occurs because of just one particular practice that is not healthy to female gender. It can also result to chronic genital infection, that is chronic pain, vaginal discharge, and itching. It can also cause urinary tract infection, and if this is not treated, the infection can lodge in the kidney, which will result to renal failure. It can as well result to mental health problems. It is proven that a lot of women and girls that undergo this particular practice of female genital mutilation experience anxiety disorder, depression, post-traumatic stress disorder, and somatic. That is physical aches and pains with no organic causes. We can see that with all we mentioned here today, there is no health benefit to this practice. All that is involved is risk and damage to the female child. So please, my people, let's end this practice. Especially where I come from. I've gone for clinicals, I've had women talk, especially when they give birth. You try to advise them that, look, you don't need to cut off the clitoris all in the name of not wanting her to jump or do this, and which is not true. I'm telling you the truth now. It is not true. That child will not jump from nowhere to nowhere. Some of those people that even scrape and cut off everything, they are even doing more. Please, let's stop such practice because it's not healthy. All that is involved in it is risk, and risk. Remember, prevention is better than cure. Thank you so much for being part of my channel today. To my returning subscribers, I say thank you. Thank you for coming. In fact, take hand. Thank you for coming back. To my visiting friends, thanks so much for stopping by. And please don't leave without subscribing. Hit the red button and subscribe to my channel. And at the same time, turn on the little notification bell at the side to know whenever I post any new video. And please, if you want to subscribe to my channel, please try and watch at least 3 minutes before subscribing, because if you just open my YouTube channel and subscribe without watching up to 2 to 3 minutes before subscribing, YouTube will remove such subscription and count it as spam. So please, let's truly support. If you have anything to add, please drop it on the comment box and let us discuss together. Thank you and see you on my next video. Bye bye.